Gather round, people. The Pandemic Podcast is back. If you've watched the Pandemic Podcast over the past 2 years, then please hit the share button. We reached over 10 million views by asking the questions that most seem unwilling to ask. And today is the second preliminary hearing of the COVID-19 public inquiry in the UK, which took place in London. And guess what? There is almost zero media coverage of the proceedings so far. So we're bringing the Pandemic Podcast back to ask the questions that no one is willing to ask and to give you full coverage of what's happening so you can be clued in on the things about the media which should be covering these key issues are failing to address. So we're about to start asking some really serious questions as we track alongside the COVID-19 public inquiry to start to piece together exactly what has just happened. Now, as with many of the classic Pandemic Podcast episodes, I've got pages of notes to go through in tonight's episode. So buckle up. We've got a lot to cover. There's a lot to cover. Okay, so we're going to be going through this at speed as I tend to do. So we want all of those who've been with us over the past couple of years to play a part in making sure that those most critical questions are answered. So please do share this conversation today, where I'm going to cover everything you need to know about the COVID-19 public inquiry to date in the United Kingdom. I've even got my Pandemic Podcast t-shirt on today. We've got a few left, by the way, so if you'd like a souvenir of these times, it says Common Sense Corner on the back. Let us know in the comments. We might have a few of those available for sale. Now, the cost of living crisis, the war in Ukraine, the death of the Queen, and yet another political leadership race has taken away all of the attention from the beginnings of the public inquiry into the handling of COVID-19. And the inquiry began on the 4th of October earlier this month. Yes, most people aren't even aware that it's begun. What a surprise. With the world seemingly moving from one crisis to the next, it's important that the response to COVID-19 does not get swept under the carpet without proper scrutiny. Now, it is said, or has been said by the officials, that the UK COVID-19 public inquiry was established to examine, consider, and report on the UK's preparations for and response to the COVID-19 pandemic. And the first preliminary hearing is already held on the 4th of October, and the second earlier today. Much of what's happened today I was able to catch live as it happened, but lo and behold, the live stream from today's event has already been hidden from YouTube, not by YouTube this time, but by the public inquiry itself. It's been made private. So I would like to send you there to review it in full. Don't trouble yourself with doing that. A, you won't find it, and B, it's probably one of the most drab pieces of content you'll ever watch. But I have caught most of the broadcast, and undoubtedly the whole session will be transcribed. But I've got plenty of notes from today's session as well to share with you. Now, Baroness Hallett, who is leading the inquiry, said that the inquiry would likely analyze the state of readiness for the pandemic and the response to it, and determine whether the level of loss was inevitable or whether things could have been done better. You'll already gather from that opening gambit that the focus is on loss. And as I'll talk about through this episode, yes, it's important that we do look at the impact of COVID-19, the virus itself, upon our population, but we can't avoid the important conversation about the loss that has occurred as a result of the policy interventions themselves. I'll talk more about that as we go along. Now, many have already commented previous to today's episode that public inquiries of this nature tend to be slow and conclude to very little change. And you're probably right. Well, let's take a look at some of the historical examples. The Chilcot inquiry to the Iraq War took no less than 7 years. The Savile inquiry into the events on Bloody Sunday in Northern Ireland took 10 years. But early indications, at least so far, suggest that Baroness Hallett is keen to ensure that lessons are learned in a more rapid fashion in order that Britain is better prepared for any future pandemic or spread of infectious disease. You'll note that I'll note that another government spokesperson said that we are committed to learning the lessons to inform for our preparedness for future pandemics, and the inquiry will be vital in doing this. Why is it that there are many who seemingly are all keen to warn of the next pandemic being just around the corner, despite the evidence suggesting that the general widespread of infectious disease is actually becoming less common rather than more likely? But there are many voices out there, usually several of those that have connections to the types of organizations and entities that tend to benefit from these types of outcomes. But that's a story for another day. We will stay in Common Sense Corner for today rather than the wider conspiracy corner, which we'll come back to. The public inquiry, however, despite best endeavors to move quickly, is already behind track after former Prime Minister, that's not the last Prime Minister, Liz Truss, the one before Liz Truss, the one, if you're starting to lose track, Boris Johnson, who dallied and delayed over the public inquiry, only to succumb to the threat of a potential judicial review by representatives of bereaved families to get the government to finally publish the government's terms of reference for the inquiry. We'll talk about those terms in a moment. Then, of course, the Queen passed away and everything was delayed further, not just the inquiry, practically everything. So the idea of expediting the inquiry is a seemingly good idea in principle, given how long other inquiries have taken, and all of that time spent to very little change. We could argue that the same is likely to happen here, but accelerating it, if provided there's a genuine opportunity to scrutinize what happened so that we can actually learn the lessons of what's gone before us, so we don't have to endure the chaos and the madness of what the last 2 years has brought us, then perhaps it's a good idea that it is accelerated. But it surely does come with a trade-off. It was stated during today's hearing of Module 2 within the inquiry that this module alone will likely receive tens of thousands of documents. And it's clear that over 10 million documents could be received under the full module outline and scope. That's obviously a significant volume of documentation. And it was estimated that it would take just over 3 years to capture only the Cabinet Office's documents, let alone any other sources that will be contributing to the inquiry. So there's a warning sign there that it could go long already, but certain decisions are being made to mitigate against that. Because, of course, all of that documentation first needs to be reviewed ahead of disclosure to core participants, who are those who are participating in the inquiry, which would then delay the inquiry even further, and also the ability to produce timely recommendations. So the emphasis is clearly on speed, but it's clearly going to be a balancing act, which inevitably will lead to some evidence being overlooked or redacted in some way, which poses some serious concerns. When that time pressure is on, will the evidence really be properly be looked at? But none of us want to wait 10 years for this thing to be over. But we'll have to question the validity of the process as we go along, because there's already some alarm bells around the kind of projection of where the trajectory of this inquiry will head, as you'll hear as we go through this. The other difficulty here is when the inquiry is taking steps to expedite the process and reduce the volume of evidence, you would want to see some level of transparency, surely, of how that was being done to ensure that the most appropriate evidence is moving forward. And there was some posturing in today's module hearing around how that would happen. But it does seem that the inquiry doesn't want to offer much transparency exactly around how this will be done. The inquiry is stated that they're going to be adopting a targeted approach rather than therefore acquiring all of the documents, all of those tens of thousands, possibly millions of documents that could be relevant. They are instead seeking documentation that the inquiry itself believes are relevant. And quite rightly, one of the core participants today asked how we will know that the inquiry will receive the most relevant material and how it would deem what is most relevant. And the answer was very telling. The response was this: we, i.e., the inquiry, ultimately decide what the key narrative events are and what the key decisions are. That's right. You will determine the key narrative and what the key decisions that have been made during the course of the pandemic. Of course you will. Of course you will. Of course, the inquiry will determine the key narrative and key decisions. Now, they did, of course, go through some kind of discussion around how the justification around how this will go through some sort of filtration process and end up with, what is most relevant. Time will ultimately tell how likely that will actually be. And the inquiry itself is kind of determined by the scope of reference, the terms of reference, which we've spoken about on not only the Elevate podcast, but the prior pandemic podcast on several occasions, which sets out the scope of the inquiry, including the broad themes that will be covered. Now, when we first covered this, we went into depth around what was clearly missing from the inquiry and the potential gaps, which obviously would lead to certain evidence being omitted before it even begins. We went on to submit a comprehensive set of amendments. If you're interested in seeing that, we'll post it inside the Elevate network, the document that we submitted to the government. We also worked alongside a number of other individuals and campaign groups that we've campaigned alongside for the last couple of years to submit other suggestions. So lots of us put forward some key recommendations in a concise fashion. And whilst not all of those suggestions were taken up, I am pleased to say that the terms of reference now include a much broader set of themes that would at least allow for the submission of key evidence to evaluate what has gone before us. Now, the other key question becomes who gets to submit the evidence? Because it's one thing having a broad scope, but if you have a narrow scope of who can submit the evidence, well, that paints a story in itself, doesn't it? So we'll look at that in a minute. And already there's some red flags, unsurprisingly, looking at module one, who's been selected. It's rather telling the angle that this trajectory could go on, this inquiry could go on. Now, the inquiry is allegedly an independent fact-finding, that's a different story, fact-finding exercise. And the terms of reference are broken down into a set of modules which will examine the evidence in a sequential way. And I'll break those modules down shortly. We've only got thorough information on the first three modules that have been published. The rest is to follow, but we have some indication around what those could be. So before I talk about where the inquiry is at right now and what's happened so far, including today, I do want to be very clear, as I've been throughout the entirety of the pandemic podcast, where we've recorded somewhere between 400 and 500 episodes in the last couple of years. I take very seriously the impact that the virus itself has had on certain people. And I want to express my sincere condolences and sympathies for those who lost loved ones over the past couple of years or suffered with serious illness, either as a direct and genuine result of COVID or as a result of the inability to get appropriate diagnosis or treatment for other serious illnesses. It's easy when you take a critical view on these things to overlook the human aspects of this situation. But quite frankly, the human aspect in itself is one of the key things that I'd want to see included within the public inquiry, given just how inhumane the last couple of years have been. Now, whilst the response to COVID-19 has without doubt created one of the single largest global challenges in modern history, it's evident now that a substantial body of evidence shows that lockdowns and other interventions not only failed to influence the course of the pandemic, but may have prolonged the pandemic and created a trail of devastating long and short-term collateral harm that far exceeds the damage caused by the virus itself. And these harms cannot be ignored. The evidence around the use of these non-pharmaceutical interventions, including the pharmaceutical interventions, in fact, cannot be ignored. The harms from both of these types of intervention, both pharmaceutical and non-pharmaceutical, have to be examined within the context of this inquiry. And I'll talk about how likely that is as we continue. Now, what I will say, in light of what I've just shared around the human approach, quite rightly, it is vital that the public inquiry does include those who are genuinely bereaved as a result of COVID-19, and I'll talk more about that in a minute. Baroness Hallett herself said that those who have suffered will be at the heart of the inquiry. And in that sentiment, there is a bit of a clue about the focus of the inquiry. Many feared that this would be all about bereavement and loss, and it's very sad and tragic that that has been a key element of what's happened the last couple of years. But surely it's important to look at the much broader range of suffering that is endured as a result of the policy responses and the government's general approach and the media, etc., to the pandemic COVID-19. And if it fails, the inquiry therefore fails to take into account the damage caused by policy across healthcare, the hospital waiting list, the loss of education, the impact on young people, the economy, which is now, I think we can all agree, in a state of ruin, the harm to the social fabric itself, the absolute harm caused to mental health at scale across all demographics, the impact on the disadvantaged, disabled, vulnerable, and not to mention the widening inequalities that have occurred over the last couple of years. We have to surely be looking at the evidence around these things. But what concerned me today was when the module discussion took place around this, around decision making. It was indicated that the decision making process would be looked at and not the results of the decisions. That to me is, as a sports fan, as a football fan, my team, if you know by now, I support Torquay United at bottom of the National League. We're not doing particularly well. If we were to scrutinise the decisions made by the manager of Torquay United, but not do so in the context of the results, well, how could you actually assess the quality of the decisions without looking at the results? So that to me raises real alarm bells. Yes, you want to look at the decision-making process. Yes, you of course want to look at how decisions were made and why they were made and who made them. But how can you do so without the context of the overall impact? So to me, that was an immediate red flag. And we have to be clear here. The long-established rule book for managing pandemics was thrown out of the window to tackle COVID-19. And now's the time, surely, to review the evidence, yes, on the decision-making, but on the harms that have been caused and ask why and how this was enabled to happen. In theory, this is what the inquiry is set up to do. But time will tell once again. And as we've said on previous episodes on this area, confidence is pretty low at this stage. But the key is who gets to give evidence to the inquiry and how much of that is taken into account. I'll come on to talk more about that in a moment, because first we need to talk about what stage the inquiry is actually at. So there's an important distinction to make. The inquiry is currently at what's called the preliminary stage. There's two phases the inquiry will go through. It will go through preliminary hearings. It will go through public hearings. So the preliminary hearings is a procedural hearing through which decisions will be made about the procedures for the conduct of the inquiry and the public hearing. So at this stage, it's all about refining the scope, getting clear on who's going to be giving evidence, how it's going to be collected, what's going to be focused on, rather than actually examining the evidence itself. But it's still a critical stage because the decisions that are made during the preliminary phase will ultimately determine what is covered within the public hearings, which will begin later next year, whereby the evidence will begin to be gathered. So during the public hearings, both the core participants, which are the groups and individuals that have been nominated to give official evidence to the inquiry, those who are core participants get full access to the documentation for review. They have precedent on how and when to give evidence. And again, for each of the core modules, there will be different core participants. So the way the inquiry has been structured is, again, over these different modules. I'll outline those modules in just a few moments' time. And there'll be different core participants for each. But I'll also speak more once I've covered the modules themselves, who gets to give evidence, because it's not limited to the selected core participants, but clearly they have a vital role. So let's run through the modules through which the evidence will be collected. So the first preliminary hearings for the first module began on the 4th of October, and it's all about preparedness, which ultimately considers the extent to which the risk of a viral pandemic was properly identified and planned for, and whether the UK was ready for that eventuality. So it's looking at whether any of the kind of prior simulation activities that we've seen hosted by global groups like the World Economic Forum and the Bill and Melinda Gates Foundation, such as Event 201, or whether the UK's own Project Signet, for instance, actually provided insight that could enable a nation like the United Kingdom or a territory like the United Kingdom to be properly prepared for something like COVID. So it scrutinized all of the prior preparation, the government decision-making relating to the planning, and seek to identify lessons from earlier incidents and simulations, etc. Now, again, through our Question Everything series that we did on the lockdown summit, we also revealed some failings in the government's preparation for any type of event like this. So that's going to be a very interesting module. But where it gets really interesting is in module 2, which commenced today. And again, it's the preliminary hearing today, where again the terms are set out rather than actually collecting evidence. The evidence for module 2 will be collected in summer 2023, module 1 in spring 2023. So module 3 begins today and examines the UK's political decision making and will cover the initial UK response to the COVID pandemic, including non-pharmaceutical interventions, in other words, lockdowns and all the other restrictions and requirements and mandates that were put into place, as well as the use of scientific expertise, data collection, modeling, government and public health communication, all of the fear-based narratives, including behavioral science messaging and the maintenance of confidence and public trust. It'll also be looking at parliamentary oversight and regulatory control. I could record hours of material on, and in fact, I have. Those of you who've watched the Pandemic podcast, 400, 500 episodes, there is literally days worth of material that we've covered on all of these things. The critical component will be how much of that will make its way, not necessarily from me, although I'm very happy to give evidence, from broad range of sources, how much will actually be scrutinized around the government's decision making and its results, hopefully. Module 3 then, which has not yet begun, and the dates for which the preliminary hearing have not yet been announced, but that will assess the impact of COVID and the government and societal responses on the healthcare system itself, generally, and on the patients, hospital health care and provisions, the impact on healthcare workers and staff. It's going to investigate the impact of decisions on the NHS backlogs, which are at record levels right now, and any non-COVID treatment, the provision of diagnostics and treatments. And again, there's horror stories emerging as a result of many of the different illnesses that have not had appropriate diagnosis or treatment. And it's no surprise that we're seeing crazy levels of excess mortality alongside potential other causes, which we'll talk about another time. So that's the 3 modules that we know about. What else is coming up? Well, very broadly, it's likely that the other modules will cover both systemic and impact issues across the UK, including one of those other causes I just referenced, vaccines, therapeutics, and antiviral treatment across the UK. Critical module. But the government has already announced that it will not have a standalone public inquiry on the vaccine rollout. My prediction is that time will come. The evidence over here in that space, whilst it's not making its way through public channels, only time will tell. Only time will tell. It's almost inevitable at some point there's going to have to be a global inquiry into what's gone on with the vaccines alone. The care sector will be another key focus. Of course, there's lots of stories there. Right now across the world, many care workers who lost their jobs as a result of mandates are now being reinstated. There's campaigns to seek recompense for those in the UK that lost their jobs. The modules will also cover government procurement and PPE. That's going to be fascinating with all the crony contracts and wasted money. Testing and tracing, government, business and financial responses across the UK and the impact on the business sector. Health inequalities, the impact of policies on education and children and young people, the impact on business and self-employed, the impact on hospitality, retail, tourism, arts, culture and sport, and the impact of COVID on public services and other public sectors. Now, the way the inquiry words this is, again, another flag for me because they talk about the impact of COVID as opposed to the impact of decisions made in response to COVID. They're 2 very different things. Laying blame on an invisible virus is one thing, but it's important to recognize that the decisions made by governments and other authorities have had widespread ramifications. And to me, there's very early indications that these things are going to be scapegoated, redacted, ignored. Time will tell. But my early suspicion is that these things are being pushed to one side and swept under the carpet. But what can we do? Well, we can run alongside as we intend to do and actually shine a light on some of these things that perhaps the inquiry will not do. Now, the critical question of who gives evidence is of importance. I've talked about core participants. The inquiry received 130 applications for core participant status just for Module 1. Now, of those 130 applications, just 26 have been designated as core participants for Module 1. So that means that over 100 were rejected. So again, where's the transparency around the selection process? And if you look at the list, which I'll post in the comments later on, if you look at the list of core participants, they're generally government um, departments, which of course you'd expect. There's outside organizations supporting the bereaved, but you've got bizarre inclusions of things like the independent sage group, which I'll talk more about in a minute because that's just ludicrous. But there's very few, if any, groups that are there who are providing critical evidence, who have taken a view that is in opposition to the official narrative that we've seen. So already in Module 1, the full list is again a huge red flag, a huge red flag. Now, critically, Module 2 is where things get really interesting. I haven't seen the full participant list for this yet. It hasn't been published to my awareness. But as soon as it does, I'll do an episode on it and we can walk through it and see, you can see for yourself the types of groups that are getting to provide evidence. But as I said, it's not just these groups that will give evidence. The public will also have their say. But Module 1 is groups representing bereaved relatives, government departments, the Health Secretary, the UK Health Security Agency, NHS England. All of these have been appointed core participant status, which clearly have a particular narrative that they will follow, alongside the public health officials that put out all of that dreadful public health messaging. Now, lawyers have been appointed to set out how the inquiry will proceed. Um, but it's very clear at this stage that members of the public and other groups who have not been awarded core participant status will get the opportunity to submit evidence. And there's going to be more informal, what's called listening events around the country, which people can attend. More on that coming up. I told you this would be a deep dive. I hope you're comfortable. Hit the share button, by the way, if you're watching this live. It's important that we start to get our head around how this inquiry is unfolding because, again, as I mentioned, the mainstream media, where's the story? You can't find it. So, as I mentioned, there's these listening events. The terms of reference required this. And initially, again, the focus is on listening to the experiences of the bereaved families. There's already been a number of listening events around the bereaved. Again, I would agree that it's vital that those voices are heard. But my serious concern here with the way in which, and there's a peer-reviewed study that's emerged in the last week, which showed how the false positive rates of testing has led to false diagnoses. How many of the bereaved have sadly actually died of COVID is a very strong concern of mine. It's going to be very difficult for someone who is suffering a bereavement to want to go for the emotional pain of confronting the fact that it may not have been COVID that killed their family member. That's what they've grieved for. But the reality is, looking at all of the data, looking at all the protocols, there's a high probability that a substantial number of the COVID bereaved aren't actually bereaved as a result of COVID. Now, if it was me, I would want the truth. I would want justice for my family member. But someone who's suffering, they've got to go through their grief and suffering before coming to that point. But it's my hope that eventually they do, because it's a very small, it's a much smaller proportion than we actually first led to believe from all of the data that we've seen. Again, time will tell that story. But it's important that the other stories are held, other than the bereaved. And again, we've talked about those who have suffered hardship or loss as a result of the pandemic, financial loss, for instance, lost their jobs, lost their livelihood, lost their minds. We have to be looking at how the impact of these measures have had on much broader groups of people than just those who are bereaved, just as important as that is. Now, the inquiry is going to do this in a number of different ways, including these listening exercises, which will be a way of gathering direct experiences from people from across the UK, including those who have been most affected, but also the voices that haven't been heard elsewhere. So it's going to be an opportunity for people like you and I to tell the inquiry our story and share our experiences without the formality of giving evidence at a public hearing, which will also be a possibility. But these listening opportunities, as soon as further details emerges on how you can participate, we're going to have to make sure that people's voices are heard. Um, and the inquiry does say that it will give everyone the opportunity to contribute if they wish to be heard. But again, we've still got that problem that I mentioned at the beginning of the episode, whereby, if millions of people show up to give evidence, how are they going to possibly evaluate that? It's qualitative information, it's stories, it's verbatim, it's words, it's narratives. To distill all of that down and to make real sense of it is a large piece of work. Um, but they seem to be endeavoring to be ensuring that people can share their experiences. And again, personally, I want to play a role in making sure that everyone has a voice, and encourage people to go forward for those things, because we've all been affected. No one has gone away unaffected by this over the last couple of years, and many of us have been through struggle, stress, and sacrifice to try and tackle some of the absurdities that have arisen over the last couple of years. Now, the experiences shared within these listening exercises are going to be analysed and reports produced, again, highlighting the key themes. I would want to be seeing transparency around how that's going to be done. It's no surprises to hear that the government's outsourced the process to two companies, Ipsos, who I understand made a woeful lash up of several things during the pandemic, and MNC Saatchi, which means that these outside units are going to be involved in managing this process and conducting the reports. So it's unclear how this is actually going to manifest in terms of collation of evidence, but again, time will tell. The aim of this type of work is actually to increase the scope of the voices heard. So it's an opportunity for you and I to give evidence. Now, in terms of the reports that are going to be created, expert groups will be given the task of creating these reports, which can be used as evidence, setting out where experts agree or disagree about the matters at hand. But then it's up to the inquiry chair, Baroness Hallett, to decide how much weight to give to the various different reports and evidence. So again, the chair is a vital role. How impartial that she will be determined, is yet to be seen. But again, I have some healthy skepticism around this due to the initial setup of the inquiry itself. Now, many of us that have followed the narrative and challenged the narrative over the last couple of years will be asking about accountability. What will this inquiry lead to? Will it actually lead to any justice? Will it actually lead to any accountability? Will any government minister be held to account? No, is the answer. Baroness Haller set out very clearly she made very clear what power she has and does not have, and she says that her role is to find the facts, ascertain what went wrong and what went well. Apparently something went well, and make recommendations to the UK on what it must learn from the pandemic response. She does not have the power to prosecute or have proceedings brought against anyone, let alone fine or imprison people as a result of their acts or admissions in respect to the pandemic. So I can already feel your reaction to that now, because the stories I hear from people who have challenged the narrative for the last couple of years is looking for that accountability, is looking for justice to be served for the decisions that have been made. Well, I'm afraid to say this public inquiry certainly won't be the vehicle to provide any form of accountability. Now, where you sit on the line, there'll be people watching this who haven't necessarily taken a counter narrative approach. You may be one of the bereaved. You may be also looking for justice in a different way. Same story applies to you, I'm afraid. No justice will be served as a result of this inquiry. It seems simply to help the government prepare for any event like this again in the future. How and when that will happen is unknown. But again, as I said at the beginning of this episode, there's a lot of talk about when the next one will come. It just seems peculiar to me. Yeah, it's really interesting listening to various different virologists on this and epidemiologists who state that it's highly improbable that we will see a mass event of this scale uh, in the same way for a long time. We didn't have, we've had big flu seasons, but the Spanish flu and COVID have been compared several times. It's 100 years between those events, over 100 years. So I'm going to conclude by sharing some reflections on what happened during today's module before recapping and where we go from here. So, to give you an indication of what happens in these types of modules, the opening marks of today's module, which looks at the kind of interventions that the government and decisions that the government took, the opening remarks took a very clear view on the official narrative, with the predictive focus on mortality. There's very little critique or questions asked about what went before us. So again, there's this pre-framing of the narrative in itself. There's very little critique, very little questions asked. But again, the questions being asked, we hope will come during the actual inquiry itself. So today's module, it went on all day today, again, looking particularly at the decision-making process, how were decisions made, what factors were considered, what scientific and medical information was included, was there viable alternatives, is there different outcomes that would have been achieved by different decisions, why did the Prime Minister and senior officials do what they did? Again, the inquiry today isn't to look at the answers to those questions, to set out those questions. They also talked about the different groups that included Cobra, SAGE, Independent SAGE. Independent SAGE. Why would the government listen to a highly partisan, i.e., far left, including communist Susan Michie, known communist Susan Michie, who's got a very distinct view of the world, a group of unaffiliated scientists who coalesced around a zero COVID approach? Why would they be included in this? I can understand Cobra, SAGE, Spy M, Spy B. But why independent SAGE? It's got nothing to do with it. But the inquiry will look at how these groups were used, what lessons can be learned, how were these groups resourced, how transparent were these groups? Not very. How effective was the decision making? Not very. I'm concluding here. I'm drawing conclusions. I'm at that point of the broadcast. Did the system allow for timely critique of decisions? Was there proper access to medical, scientific, and data? How effective was the modeling? I could do a whole episode on that. In fact, I have. How reliable was the modeling? Was there an over-reliance on epidemiological modeling? I think so. Again, all of these things are going to be looked at during the course of this module. Evidence will be submitted later next year. They'll be looking at lockdowns. How effective were lockdowns in controlling transmission? How were the economic and societal impacts assessed and weighed in balance of decision making? What would be the likely effects of different or earlier interventions? Again, there's a real emphasis on what would happen if we did it earlier, longer, harder. Would lives have been saved if lockdowns had been posed earlier or differently? Again, this is a narrow focus. They'll be looking at the public health messaging, the effectiveness of people following the public health advice, were people following the science, the maintenance of public confidence and trust. All of these things are going to be looked at in Module 2, where the evidence will be held next year. And again, experts are going to be selected and circulated to support this kind of evaluation of these key things. So they're going to get experts in to look at the different models. I'd love to see a genuine epidemiological independent expert looking at the models, because if you predict results of anything and are woefully inaccurate so many times, you have to question the underlying validity of the assumptions and the data that's been used to create the models. If there was someone truly independent, looking at this, I'd love to hear what they had to say. So all of these things are going to be examined within the context of the public inquiry. It's a huge process. I don't envy those involved, to be quite frank. It's a huge process. The desire to have it expedited, the desire to move quickly, I think time will tell if they can actually achieve that. They're already showing signs that in order to take proper account of the evidence, it could take slightly longer. But my greater fears about moving quickly is that things won't be properly scrutinized. But uh, we will see. We will see. So this is the end of my pandemic podcast comeback, uh, looking at the COVID-19 public inquiry in the UK, everything you need to know so far. There's a lot more I could say about Module 2 today. We will be taking I've got the transcripts from Module 1. I'll get the transcripts from Module 2. There'll be more on this. We're going to use the pandemic podcast to track alongside the public inquiry. We're getting our heads together around how we can work with other media outlets, with other groups to actually play a role in running alongside this public inquiry to make sure that the proper scrutiny at least happens somewhere if it if it doesn't happen within the official investigation. And more so, we've got to start getting the real stories into the media, because if you can get into the mainstream media, it's going to put a weight of pressure on this inquiry to look at things properly. So watch this space. It's been a pleasure bringing back the pandemic podcast. As I said, I'm wearing my pandemic podcast T-shirt today for this episode. If you'd like one, we've got a limited number left. Do respond in the chat, and we'll send details about how you can get one. And there's a number of resources that I'll be sharing that I've accumulated from my preparation for this episode, which we'll be sharing inside the Elevate Network. The Elevate Network's our private online community where we're examining issues like this and more. There's a community of over 5,000 people now who are sharing different resources, and we're all sharing ideas about how we can tackle with issues not just like this, but also free speech and the rising global agendas that are rapidly unfolding in front of our eyes. So if you're not yet a member, go over to weareelevate.org. You can browse it before you join. You can have a look around. You set up a profile and become part of our private community if you decide to. So the last thing I'll say, importantly, if you're interested in the subject of the public inquiry, we have a fantastic panel event coming up this Thursday night. So I'm delighted to be joined on Thursday by Professor David Patton, who is the Chair of Industrial Economics at Nottingham University, Dr. Claire Craig, who's a diagnostic pathologist. Many of you know Dr. Claire Craig. We're joined by Professor Paul Freuters, who's a Master's in Econometrics, Barrister Francis Hoare, and Dr. Liz Evans. We're going to be getting together for 90 minutes, 2 hours, to deepen this conversation, to open up the floor to what we're observing within the COVID inquiry so far, giving a different set of perspectives from a different set of experts. If you'd like to take part in that event, if you'd like to come and join us, go over to danastingregory.com/public inquiry. That's danastingregory.com/public inquiry. The link's there on the screen. You'll find out how to register for the event. And I'll say we've got another fascinating event coming up next Thursday. So the public inquiry event is happening this Thursday night, 8 p.m. UK time. We'll be taking a deeper look at what's happened so far. And then next week, next Thursday, on the 10th of November, we're having a private screening of the Safe and Effective documentary, which offers a second opinion on the COVID-19 vaccine rollout, which was recently censored after reaching nearly 1 million views on YouTube. We've got a private director's cut screening. We will have an introductory talk from producer and director Mark Sharman and the team at Oracle Films. And we'll also have an open Q&A session with Mark and Phil from Oracle Films. So if you'd like to get access to both of those events, then you can become what we call a supporter within the Elevate Network. It's £10 per month, and it gives you access to all of our events, all of our live events, including our entire back catalogue, including our private session with Matthias Desmet, Charles Eisenstein, all of our censored content that you can't get anywhere else. So for just £10 a month, you can join us for both events coming up in November. All of our forthcoming events are included, or you can purchase a standalone ticket for the inquiry. So just go to danastingregory.com/public inquiry. You'll find all the details there. And by becoming a supporter, you help support independent media, independent voices like myself, who are out there challenging the narrative and asking the questions that most seem unwilling to ask. So it's my hope that you will join us at one or more of these events, and you'll help to support what we're doing, because together we can challenge the narrative and we can get closer to the truth. Thanks again for tuning in tonight to today's special episode of the Pandemic Podcast, giving you everything you need to know about the public inquiry so far. Thanks again for tuning in. My name is Astin-Gregory. It's been great to see you again this evening.